And here with us now are Dr. Jane Boland, Professor of Healthy Policy Management at the Texas A&M School of Public Health, and Janet Helduser, Senior Program Coordinator for Cancer Screening, Training, Education, and Prevention, or CSTEP. And ladies, thank you so much for joining us this afternoon, because I think this is one of those where you hear the jokes and you hear about people saying, I'm not getting that screening because I imagine it's not fun, but the benefits certainly outweigh the uncomfortable moments that you feel for just temporarily.
Yes.
And so tell us about, there's good news recently. There's already a program through the Health Science Center that helps people in our community, but recently you received more money that should help even more people in the next several years.
Correct. Yes, the CPRIT Foundation, or the CPRIT program in the state of Texas, helped fund over 800 free screenings in the past 3 years, and we received a 3-year extension, and we're moving out into even more counties surrounding the Brazos Valley and including here in the Brazos Valley.
And Janet, this is something that's close to your heart, and I think it's evident when people are connected to a cause, and I think it's very just inspirational that people are willing to use it as a teachable moment, and really help other people get healthy. Tell us about your story and your involvement.
Yes, well, colorectal cancer is the second leading cause of cancer-related deaths, so most of us know of someone or have been touched in our own family by cancer deaths. But the thing is that colorectal cancer, it's sort of a stealth cancer. It's really highly preventable. There are significant lifestyle changes people can make to avoid colorectal cancers. That includes things like decreasing their intake of red meats and processed foods, increasing their fiber, the usual, eat better and more exercise, avoiding tobacco products. Tobacco actually doubles your risk of colorectal cancers.
And again, I think this is something that, unless it affects us directly, we don't really know about it. But
right.
What is this type of cancer? Because you hear about the breast cancer and other things, and
sure.
That maybe we are more aware about, but this one seems to be one that doesn't get discussed nearly enough if we're seeing these mortality rates as high as they are.
Thank you. Well, colon cancer starts in the large intestine or rectal area, and it usually starts as an unwanted growth called a polyp. And those polyps are silent, they're asymptomatic, and someone may not even know they have them. And over a period of time, they progress to cancer and invade the large colon and progress out into the body and metastasize. So by having screening starting at age 50, or if you have a first-degree relative, such as mother, father, or a sibling that has had colon cancer, you should certainly be screened for polyps. And then they can just easily be removed and tested, and then you can have follow-up. So it's very important to be screened because they're so silent until they invade.
And the most common barrier for people is cost. And so this grant to the Texas A&M Health Science Center allows our Physicians Family Medicine Center to provide free colonoscopies for people that are uninsured, or even for people that are insured and they simply can't afford that copay maybe that goes along with their insurance deductible. Those people also can financially qualify for colonoscopy. All they have to do is contact our community health workers, and those two wonderful women will alleviate their fears, answer their questions, assess their risk for colon cancer, schedule their procedures, do the reminder calls. So it's a very easy process. Someone can simply go to our Texas CSTEP website or the clinic's number at the 436-0443.
I think, do we have that on the screen? There we go. We certainly want you to jot that down, whether it's that website or the phone number. I know the phone number was also listed on the website. Now, in the piece before our interview, the gentleman was told that he didn't have to get another screening for about 10 years. I imagine best case scenario, if there's no family history of it, that you really don't, it's not an annual thing.
Exactly. If you're asymptomatic and you have it at age 50, then studies have shown that it's unlikely that you will have any polyps or have cancer develop within the next 10 years. But it's mainly just doing that initial check, or if you do have a first-degree relative, getting in a little sooner, which is about 10 years earlier than when their cancer was diagnosed.
Well, ladies, we appreciate you, of course, for your efforts in our community, and thanks for joining us this afternoon to let people know. We certainly hope that cost is not a factor when people consider getting the screenings that could save their lives.
It's well worth the investment.
Thanks, ladies.
Thank you.